So, what are the symptoms of CMV infection and CMV disease, and what are the differences?
So, as we mentioned earlier, there's a whole range of symptoms. So, for example, with CMV replication, where there's evidence that CMV virus is there, some patients may be completely asymptomatic, so have no symptoms at all. Some people with CMV syndrome will have evidence of replication, so we can find the virus there, and they will have some kind of what we call a prodromal illness, so flu-like illness, aches and pains, fevers, feeling tired. And the next step up from that is CMV disease, where patients may have all of the above, but also some evidence that the CMV infection is causing a problem in a particular organ. And CMV is what we often describe as a real chameleon virus because it can cause so many different variable effects. The CMV, if it causes CMV disease, it can affect your brain, can affect your eyes, your lungs, your bowels, your liver. And depending on which organ is being affected, those are the problems that we will see. So we often say to our trainees that are coming through and to all the staff that if a transplant patient does not look well, does not feel well, we always need to remember, and on the bottom of our differential. So that's our kind of little list that we're trying to think, what we think is going on. That could this be CMV? Because that's the nature of CMV infection, and we'll have a look at a short video which summarizes some of what we've discussed.
Cytomegalovirus symptoms. When the immune system is not working properly, CMV may start to multiply and can affect many organs in the body. CMV infection may present with no symptoms at all in some patients following a transplant, and the only way it can be detected is generally through a blood or urine test. In other patients, CMV infection can present with common flu-like symptoms such as a sore throat, aching muscles, tiredness, a high temperature, skin rash, or feeling sick. Patients who are diagnosed with CMV disease may experience some of the symptoms of CMV infection we have talked about so far. However, there will be evidence of CMV affecting a particular organ in their body, and so in addition to detecting CMV in blood or urine, it can also be detected by a biopsy from the affected tissue. CMV disease can affect the lungs, causing pneumonia, which has symptoms of cough and shortness of breath. If CMV has affected the stomach and intestines, symptoms can include pain and difficulty swallowing, abdominal pain, nausea, and diarrhea. If CMV disease affects the liver, symptoms of jaundice, including yellowing of the skin, abdominal pain, and flu-like symptoms can present. In very rare cases, CMV disease may affect the brain, the spinal cord, and the eyes. If CMV has affected the brain, it can cause sensitivity to light, seizures, and weakness. In some instances, CMV disease can affect the transplanted organ, which increases the risk of the organ being rejected. Depending on your risk of developing CMV infection and the routine practice at your hospital, there are two different options to prevent CMV infection and disease following your transplant. The most common option is that you will be given medication to prevent CMV from multiplying in your body, and you will start taking the medication on the day of your transplant or shortly after. Doctors call this type of CMV therapy CMV prophylaxis, which is given to prevent the virus from multiplying in the first instance. Alternatively, your doctor may want to monitor you until he or she sees the virus multiplying, and only when evidence of CMV infection is detected in your urine or blood will you be given CMV medication to prevent the virus from multiplying even more. Your doctor will refer to this second type of CMV therapy as preemptive therapy. Both options are effective ways of preventing CMV disease from developing.
So, how do you test for CMV?
So this has been one of the real advantages for how things have evolved, and now it's really easy for us to test for CMV. And the commonest ways are usually to try and find evidence of CMV virus replication in bodily fluids, which is almost always blood and sometimes, for example, urine. very rarely we will need to get a tissue diagnosis. So that means we need a biopsy of an affected organ to pick up evidence of CMV virus. And sometimes people may get, our transplant patients will often get biopsies just like anyone else. And sometimes people may be found to have CMV on the basis of that biopsy alone. But when we're suspicious of CMV, the first and usually the only thing that we really need to do is to check your blood to see if you have CMV.
Do you feel someone should consider an organ if the donor is CMV positive?
Absolutely. And the main reason for that is, as I've already mentioned, the majority of people in the UK have been exposed to CMV as adults, and therefore the majority of people will be CMV positive. And while we are talking about the importance of CMV infection and disease after transplantation and some of the problems it can cause, CMV is now an easily detectable condition, and it's an easily preventable and treatable condition. And the benefits of getting a kidney transplant, even if you are in the high risk category of the donor being CMV positive and you yourself as a patient being recipient CMV negative, the advantages of the kidney transplant if you're living with kidney failure versus being on dialysis are overwhelming.
Will CMV affect a transplanted kidney?
So I mentioned the CMV can affect any organ, but it's actually quite rare for it to affect the kidney. I'd say maybe in less than 10% of cases will we see evidence of CMV nephritis, so virus kind of causing inflammation in the kidney. CMVs, when it causes CMV disease, it's much more likely to cause gastrointestinal problems. So that's anywhere from your mouth to your tail end. Now, that's from a direct point of view, but indirectly, yes, CMV could affect your transplant kidney, because if you are unwell from CMV infection or CMV disease, if you're not eating and drinking very well and you're becoming a bit dry and dehydrated, or you're not able to take your tablets properly, then that can indirectly affect your transplant kidneys. Or if, as part of the treatment for CMV, as we'll go on to, part of the treatment is to think about whether we can lower your burden of immune suppression, and that obviously comes with a risk. We're lowering the burden of immune suppression to obviously try and help your body fight the CMV infection, but that comes with a risk that if we lower your immune suppression too much, it gives your immune system a chance to recognize that foreign kidney and cause you rejection.
That just leads me to my next question, really. Does the risk of CMV change depending on the organ received?
Yes, and different organs come with different risks. So for example, certain types of transplants, such as lung transplantation, our lung transplant colleagues have to use a higher level of immune suppression in the context of lung transplantation, and therefore, because the level of immune suppression is a lot higher, the risk of getting things like CMV is higher. And it also makes a difference with regards to the level of kind of CMV virus that can come with different organs. Obviously, as kidney transplant patients, our patients may sometimes get other organs. It's quite common to get a kidney with a pancreas transplant, for example, if you have type 1 diabetes as the cause of your kidney failure. And in those circumstances, we often do have to use a slightly higher level of immune suppression, and therefore the risk of CMV will be a little higher. So different organs do come with different risks, and a lot of that risk depends on how much anti-rejection therapy that individual needs.